Dr. Joseph Hewitt. I'm a vascular interventionalist with Pedes, Orange County. We're a group of dedicated professionals specializing in treatment of vascular disease of the leg. Peripheral arterial disease, also known as PAD, is a common yet serious problem affecting millions of Americans. It results from a buildup in the arteries bringing blood flow to the legs, causing an obstruction to that blood flow or a serious slowdown in the blood flow. Nearly everyone who's affected by PAD, even those patients who are asymptomatic, isn't able to walk as far or as fast as they could have before they had PAD. Nearly 1 in every 20 Americans is affected by PAD. PAD is also associated with heart attack and stroke, very significant medical conditions. Your referring physician has referred you to us here at Pedes, Orange County because he or she believes you may have PAD. Today we're going to do some simple diagnostic tests to help determine if you do in fact have PAD. If you do, we'll thoroughly discuss all of your treatment options with you. Peripheral arterial disease, or PAD, is a very serious problem with some very common risk factors. If you're over the age of 50, you have an increased risk of PAD. If you smoke, or you ever have smoked, you're at 4 times increased risk for having PAD. Diabetes is also a significant risk. In fact, if you're over the age of 50 and you have diabetes, there's a 1 in 3 chance you have peripheral arterial disease. High blood pressure and increased levels of cholesterol in your blood also increase your risk for having PAD. If you ever have had a heart attack or a stroke, there's a 1 in 3 chance you have PAD. And finally, if you're an African American, there's a 2 times increased risk of you having PAD over a similar Caucasian individual. Many of our patients wonder what PAD looks like. And while some patients are asymptomatic, most patients have signs and symptoms that are fairly common. Claudication. If you feel heaviness or tiredness, fatigue in your legs with activity, this is abnormal. Many patients attribute this to older age or some other disease state, but it may be attributable to blocked arteries in your legs. Pain in your legs or pain in your feet that keeps you up at night or disturbs your sleep is also abnormal. Sores or wounds on your feet or your legs that heal very slowly or don't heal at all may indicate a problem. Color changes in your legs and feet that persist are also abnormal. If you see an abnormal paleness or blue tint to your legs, this may be a sign of PAD. A lower temperature in one leg versus the other is also not normal and may indicate an obstruction to blood flow. And finally, if your nails don't grow the way they used to, or if you're losing hair on the bottom of your legs or your toes, this may indicate a serious obstruction to blood flow in your legs. Now that you're here at Pedes, Orange County, we're going to figure out if you have significant peripheral arterial disease. For most of our patients, this means we're going to use ultrasound to take pictures of all the arteries in your legs to determine the extent and significance of any blockages that you may have. Once we've acquired these pictures, we're going to take the time to sit down with you and thoroughly discuss your medical history, your signs and symptoms, and talk about the tests we just did to determine an appropriate course of treatment going forward. Our goal here at Pedes, Orange County is to provide you with confidence and assurance with your health care. Once we've reviewed your medical records, discussed your signs and symptoms with you, looked at all the ultrasound pictures of your arteries, we're going to put you into one of 3 broad categories. The first category is no PAD. If our thorough tests show that you don't have any evidence of peripheral arterial disease, we'll send you back to your referring physician with a clean bill of vascular health. The second category is mild PAD. These are patients that have a small amount of blockage in their arteries, but do not need any treatment at this time. In this case, we're going to follow you with ultrasound about once every year. If your disease ever gets to be significant enough that it requires treatment, we'll discuss your options with you at that time. The third category is significant PAD. If you have significant PAD, we'll sit down with you and discuss all of the risks, benefits, and alternatives of the various treatment options that are available to you. Peripheral arterial disease is a serious problem with potentially severe complications. While many of our patients are asymptomatic, many other patients experience a progressive decline in their tolerance for walking or other physical activity. This is often associated with a declining quality of life. Other patients with more severe symptoms experience progressive disability due to pain. Some patients with severe PAD may develop non-healing wounds and require amputation if left untreated. Our goal here at Pedes Orange County is to use the most advanced diagnostic imaging techniques along with cutting-edge treatment modalities to bring each and every one of our patients back to optimal vascular health. By working closely as a team with you, the patient, and with your referring physician, we'll get you back on your feet.